I was thinking today about how when government frames a debate, we're often pigeonholed into this weird situation full of false dichotomies. For example, during the healthcare debate, the stated intent was to improve healthcare. The proposed solution was health insurance reform. Thus, the political debate framed the argument as follows. Access to good healthcare is a human right. Nearly 30 million Americans are not readily able to access good healthcare because of their lack of insurance. Therefore, healthcare insurance reform is healthcare reform. Suddenly, like horses with blinders, Americans begin discussing healthcare as synonymous with insurance reform. The Democrats are on one side, advocating single-payer policies. The Republicans are on the other side, debating and attempting to kind of hold back the reins of expansive government, so they say. What we end up with is a giant bill filled with legal bribes, known as earmarks, and a critical mandate urging all Americans to purchase health insurance. So now the reality is, regardless of what you think healthcare is, or whether you think it's a right or not, you have to admit that it's sort of an erroneous distinction to equate healthcare reform with insurance reform. Although since it's the dichotomy we've been presented, and since most of us aren't well versed enough in the healthcare debate to really form a coherent opinion about how the system should be fixed, or even whether it should be fixed, it's probably a safe bet that most of us find it hard to think about healthcare reform as anything other than health insurance reform. Well, today I stumbled on this amazing frontline piece about a doctor with a bit of knowledge in demography research. His analysis led to the realization that about 1% of the population of Camden, New Jersey, accounted for more than 80% of the healthcare costs in the city. One building alone accounted for more than $80 million in accumulated bills to the hospital. What did he do? He started an organization to begin reaching out to the people who accounted for these costs. The man they show in the documentary, the sick man, went from visiting the hospital nearly 30 times in 6 months to twice in 6 months. The doctor describes it as a blockbuster moment for the healthcare insurance industry, or healthcare industry in general. When Netflix came along, Blockbuster decided to kind of ignore the presence of Netflix. Then suddenly, when Netflix was too big of a behemoth to stop, Blockbuster collapses under its own apathy toward Netflix. Anyhow, this huge reduction in medical costs, if the program works in other places, could be a real game changer. I hope, though, that the government doesn't step in and make this program law, because, you know, it's a free market. So if it works everywhere, it would spread everywhere. But if the program only works in some places, like, for example, major cities, then it would probably only spread to those places, which is probably appropriate. And then a different solution would be come up with in, you know, maybe rural areas, if that was a thing. That doesn't really necessarily pertain to rural areas. But for the most part, his program seems like it works where it is, and it seems like it could be a solution that other cities could use. Needless to say, I'm really glad to see that the American spirit of ingenuity is alive and well.